Dr. David Ajibade, and welcome to Your Health in Your Hands. Remember, everything we do on these programs is to help the Nigerian, the black person, if I may use our term, know more about their health, the risks that they are specifically faced with, and what they can do, where they can go for help. So today we have a very, very special guest. We're going to get into that in a minute. But remember, you can always join us on our platform, social media platforms, so you can check those out. Today we have, like I said, special guest. He's the Director General of the Nigeria Center for Disease Control. And we're going to be talking about some of the things that are pertinent around the country and some of the things that he's focused on. And just recently, I was just telling him that we went to visit his office, and we've seen amazing things that he and his team are doing. So without much ado, I'm going to say welcome, sir, Dr. Chikwe Ihekweazu. How close was that?
Dr. Ajibade, it's close enough, but it's Ihekweazu, but yeah.
My apologies. Now, Doc, you look a little tense. This is your first time on TV.
No, I hope I'm not looking too tense. It's a privilege to be able to address Nigerians very frequently on the risks that we're faced with infectious diseases, but also on the opportunities to control these diseases and share the progress that we're making as a country in this direction.
Fantastic. And you've been the DG now for about 2 years.
Okay.
Some of the things, again, like I said, we went to your office yesterday, and again, very impressive. And the changes that have been made, including staffing, monitoring, and evaluation, and this collaboration with the states and the local government areas, all that is huge. Can you just give us an overview of what you've been doing and a projection for what you see in the future?
Yeah. So thanks. You see, the Nigeria Center for Disease Control is a fairly new parastatal. And we've been in existence for just under 8 years now. We've just got our legal mandate actually last year, but we've been existing a little bit longer than that. Our mandate is very simple actually. It's to prevent, detect, and respond to the threat of infectious diseases. Infectious diseases are caused by bugs, viruses, bacteria that have been with us for many years. When I say us, I refer to the global community. But I think the thing to remember is in many parts of the West, a lot of these infectious diseases have either been completely eliminated or reduced to a level of significance that is no longer a big burden on society. We haven't quite gotten there in our context. There are several reasons, but I think the progress that has been achieved in other parts of the world demonstrates that it's also possible here. And as much as in our context, if you listen to the conversations of Nigerians on a day-to-day basis, everybody's worried about elections at the moment, physical infrastructure, security, power, and all the other things that we think we require to live comfortable lives. But ultimately, we want to be alive.
Right.
And if the things that we should lose our lives to, let them be those things for which we don't have solutions yet. Some cancers, some forms of heart disease, and a lot more complex to deal with. But really, infectious diseases, we have a lot of tools to prevent these, and what we now want to do as a country is really to push on our efforts to control the things that we think we have tools to do already, and so we can move on a little bit to the more complex issues.
Right? Not serious, but more complex. I agree. So, infectious diseases, that's the primary focus of Ncdc. Okay, and which are the main ones we're looking at?
So we have about 5 priority, what we call epidemic-prone diseases.
Okay.
So the infectious diseases like HIV, TB, malaria, for which the vertical programs dealing with them, and they require slightly more long-term strategies. But the epidemic-prone diseases are measles, meningitis, yellow fever, Lassa fever, and cholera. We've just added a 6th one, monkeypox. And these are things that come up sporadically, come up with huge intensity, cause a lot of anxiety in our populations, and we are trying to really hone down on these and see that we educate Nigerians, healthcare professionals, policymakers on the options that we have available to prevent, detect, and control these diseases so that we can feel safer as a society.
Now, Lassa fever, it seems like that's become of particular interest in recent times. We always thought Lassa fever was something of the north, where it's like dry, windy, dusty. But I'm hearing stories about it's happening further down south. What's going on?
Yeah, you see, that misperception is really because the first case of Lassa in Nigeria was detected in a patient in then Borno State, in a village called Lassa, which is actually what the disease was named after. But over the past few years, we've seen a preponderance of the disease actually happening in the south. The three what we call hotspot states are Edo, Ondo, and Ebonyi.
Wow. All down south.
All down south, yeah.
Wow.
I mean, we do see cases all the way. We have a kind of trajectory from the kind of south central, southwest to the northeast. So, from Ondo, Edo, going through FCT, a bit Plateau, Taraba, in that kind of direction. So it's a weird trajectory.
Is there a reason for that pattern?
So you see, we're not quite sure about that. What we know is that a lot of last year we had the largest outbreak that we've ever had in Nigeria. And this year it looks like we're going to have one bigger than last year. Now we think that the biggest driver of this is actually, we're a bit of a victim of our success, that we have been doing a lot of work educating Nigerians, educating healthcare workers, improving diagnostics, increasing the laboratory capacity to detect. So as we've looked more, we've found more. So it's a little bit like we've put a microscope on an issue and we're beginning to see, we have a lot more of this around. So we think there's a lot more of Lassa fever around. We're finding a lot more. But that gives us a big opportunity to push on prevention, detection, and response. So yes, it will appear like we're having more cases, but that's really because we're increasing our ability to detect and respond to these cases.
I see. So because I was thinking, is there something like the terrain? Because you basically showed a specific region of the country. Is it the terrain? Is it the culture? Is it some practices that they do? Just hold our thoughts. We'll be right back after this break. Thank you. Welcome back. We are talking about infectious diseases in Nigeria, and specifically before the break we were talking about Lassa fever, and there seems again to be a trend where it's most commonly found, and Dr. Chikwe was just explaining to us about that. So what is the trend and why is that so?
So like I said, there's an increased detection of Lassa, and really the reason is this. Historically, we've treated almost every fever in Nigeria as malaria and not really focused on diagnostics. So a few things have changed. In the last 5 years, we have had a very good test now available, a rapid diagnostic test for malaria. It took a lot of time to build the confidence of doctors in this test, but now confidence is increasing. So the question started to be asked, okay, if it's negative for malaria, what else is it? And, previously, you do several rounds of broad spectrum antibiotics and all. But what we have now started encouraging doctors to do, which they're doing increasingly, is if it's not malaria, there are opportunities to test for the other things. And even if you can't do it in your own lab, we have specialist labs that can do this. So send us a sample. In addition to that, we now set up a system that makes it a lot easier for doctors to send samples through a private courier firm to one of our reference labs. So from every state capital, we will collect those samples, send it to the reference lab, and provide you a diagnosis. So, that's really improved the ability to make this diagnosis and therefore start treatment early. For Lassa, it's critical. Just one last word on this. Those that succumb to Lassa are really those that present late. If we have the opportunity to intervene early and start you on treatment, you're much more likely to survive. So that's the essence of early diagnosis for Lassa.
I think that's fantastic. So there's now the ability, if people know about it, or doctors, some healthcare professionals know about it, they can take these samples and send them.
Call a single number in every state. The sample will be collected from your facility and sent to our lab. So
free of charge?
Free of charge.
No way.
So the only difference, and I'll be open, we haven't quite sorted out the mechanisms within the states. So sometimes there's still some logistics to get it to the state capitals. But we can collect that sample free of charge from every state capital in Nigeria, take it to one of the 4 existing labs. We have a lab in 4. We've divided the country for this purposes into 4.
Okay.
Our goal is to get to 6, 1 per zone,
Sure,
but we're at 4 at the moment. So we will collect the sample, test it, send you back your result. So if you need, within, once it gets to the lab, it takes 12 hours to get the result. So really, the delay is in the logistics of getting the samples to the lab.
So turnaround time is around 48 hours.
48 hours, depending on 2 working days, 48 hours. If it's a weekend, it may take a little bit more time.
Got it. Well, that's impressive. That's kudos again to you and your team for putting that in place. So I know we don't have much time. Lassa fever, that's one of the 5 or 6 that we mentioned. But before we move away from that, what are the practices that people are, involved in, engaged in, that makes them more prone to getting Lassa fever? Yeah,
so I will start with Lassa and then maybe even move to the others. I think there are many things we can do ourselves, and really this is our message for Nigerians. The Nigeria Center for Disease Control can only do so much. We provide guidance, support our colleagues, but there's a lot of power in the hands of individuals. For Lassa, really, the biggest risk factor is access of rats and rodents to our foodstuff. So the simple message we share all the time is keep your food covered, safe in the kitchen, packed away. But there are a lot of other things we can do to prevent the rats even being attracted to the households in the first place. So if you have a heap of refuse outside your home and you're waiting for somebody to come from somewhere to clear it, there's a day-to-day risk for you. So, we can organize within our communities, and this is not just at home, on our streets, schools, our churches. If you go to church and you see a big heap of refuse just outside the church and think it's someone else's problem. No, it's your problem as well.
It's going to come back and bite you.
Absolutely.
Right.
There are things we do like, yes, we need to sometimes burn grass and bushes in our villages for farming purposes. But, this has a direct consequence on the rodents that live in those farms, because you now chase them away from the rats closer to your homes, and they start looking for food within our villages and our houses. So we have to always think about the collateral damage of things that we do that we think are well-meaning.
You're saying that this age-long practice of, time and of bush burning.
Yeah, I agree. It's difficult to change, but there are practices if you're now aware that by burning this bush today, the consequence is that there might be more access to rats tomorrow. So within those few days, at least you can take extra precautions. If you used to keep a few things at ground level, take them a few steps higher in your kitchen. Just make it less accessible to rats for that period of time. Because the challenge with is you don't see it in the morning. These are passed by rat excreta that are very hard to see. So you don't come out in the morning and know that anything has happened to your gari or your rice that you stored in the kitchen, or your yam that we piled up and we have cut halfway and put half open for the next day. You don't see it. So meanwhile, it's been visited by our guests overnight.
So is the saliva from the rats and not the excrement?
It's the excrements, but you don't see it because of its size.
Okay.
Yeah.
Okay. All right, so that's an important thing, folks. You need to keep your food safe and covered, and as much as possible, don't burn refuge too much around your area. Dig a pit.
Absolutely. Use whatever local solutions you can come up with. Yeah.
All right. So we've done Lassa fever. Where should we go on to next?
I think for all the others, there are always things that we can do ourselves. There are things that we will try and do, and we will push on them. So let's take yellow fever, for example. We had a big outbreak in Edo State and a number of other states last year. Yellow fever is really one of those diseases that we shouldn't be having outbreaks, because there's a very effective vaccine available. Has been available for years, is free of charge in every primary health care center. Wow. Government has been pushing very hard to ensure availability of the vaccine. You need just one shot to be protected for life.
For life.
For life,
Okay.
So really, it's a very effective vaccine, one of the oldest we know. So if your kid gets that vaccine, you are not going to have yellow fever. So and really, for those diseases for which there's a vaccine available, for yellow fever, for measles, we're really appealing tonight. Please take your kids out. It saves you a lot of hassle. It could save their lives, and really will, allow us to focus on the more complex disease.
Right.
For things like cholera, there's no magic health solution to cholera. Cholera is really a disease of water, hygiene, and sanitation.
Right.
If you have good water, potable water, you boil water, you're not going to have cholera. So as much as we keep putting those prevention messages, we understand that the provision of water is a complex thing. The state has some responsibilities of providing drinking good pipe-borne water, but this can't happen everywhere. So for every disease, there's a lot that we can do from the health side, from government side, a lot health professionals can do, but a lot lies in the hands of everyday Nigerians.
Absolutely, absolutely. So we're going to go into some of the other things that some of the things other Nigerians should do, and some of the things we can do in collaboration with healthcare professionals. And I think that's a really, really key part, because of course people always listen to healthcare professionals. So we'll be right back. Give us a few minutes. Okay, we are back, and you are welcome back as well. So we're going to be talking about the role healthcare professionals can play and what the Ncdc can do to help them play that role. All right, where do we start with that?
I think let's start from the very simple thing, the case of fever. I think for many years, even when I was trained, and maybe when you were trained, we were trained that every fever is malaria until proven otherwise.
Yeah.
But we forget that proven otherwise. We just take the first bit every.
Well, we'll move on to typhoid afterwards.
Yes, and and go down that line. But really, we have new tools. I tell patients, I tell my family, no matter how good a doctor is, no doctor can make a diagnosis of malaria by looking at you doing a physical examination. It's just not possible.
Right.
So you deserve a test, and so both for healthcare workers and for patients. It's a new era. Patients are empowered, and they can go and search for these things. So you don't do yourself any credit by pretending you're God. You do yourself credit by explaining to them it could be malaria, it could be other things. The only way we can know is by asking you to do a test. Do that test. If it's malaria, wow, fantastic, simple treatment. If it's not malaria, let's start early looking for other causes. So that's our first broad-based advice to all patients and healthcare workers.
Hard sell, though. Maybe a hard sell for some people.
It's hard, and that's why it's still causing us all these problems. But we recognize that change management is difficult. Changing practice is difficult. It's difficult for patients. It's difficult for doctors. It's difficult for nurses.
Right.
But we're pushing on this, and that is the reason why we're finding more Lassa fever cases now, because doctors are listening.
Right.
In areas where they're listening, they're sending more samples for testing for other causes, and those results are coming back. So they are listening. Credit to a lot of doctors around the country. Good. And I think it's also fulfilling for your practice to be able to make, you go to some doctors and, they're accused that the only thing they do is treat malaria. But now suddenly you're finding other causes, and it's also really empowering for healthcare workers to have the ability to diagnose other diseases.
And treat those diseases effectively.
Absolutely,
right?
Absolutely.
So do you do seminars? Do you travel around? Do you trainings, webinars? Or how do you?
Absolutely. It's a big country, so it's really depending on the resources that we have. But this is a whole new area of work for us. What we're trying to do is not do everything ourselves, but educate others to do so. Working with the states, working with tertiary hospitals in Nigeria, professional organizations, NMA, the pharmacists, laboratory scientists, organizations. We're really working with them to take these messages down to the colleagues.
Are they cooperating?
They are. The reception, you see, the amazing thing I have found personally since I took over the leadership of Ncdc is, we have a resource in Nigeria that we don't use enough. We have people. people that are waiting to be activated to work. And many times if you come in and you see dormant people standing around, don't jump to the conclusion that they don't know anything. They know, and they have the capability to do a lot of work once you push them a little bit and incentivize them to deliver. So I think by opening up, we have really attracted and pushed a lot of people. And if you hear about the progress achieved by Ncdc, it's not Ncdc alone. It's Ncdc working with the states, lots of partners, professional organizations, and all of that. And you know, last week we got an invitation by the CMD of the Federal Medical Center, Butemeta. This is a small federal teaching hospital on the outskirts of Lagos, inviting us to come and train his doctors on infection prevention and control, offering to pay whoever we need to send to Lagos to support his staff.
Wow.
So to me, that was such a reinforcing event in the success of what we're doing, because IPC doesn't generate revenue for hospitals, so they often don't focus on it. But some are beginning to recognize that actually, if patients have confidence in your practices, if you know, focus on infection prevention and control is there, you will get more patients coming in. And that's the message we're trying to push for doctors, for hospitals to actually invest in these things that may not be visible in the beginning, for which the impact on your patient flow might take a while, but Nigerians are becoming more discerning, and the quicker we react to this, the better for the health system in the long term.
Interesting, interesting. So hospitals are opening up, they are becoming more open to this. How about pharmacists? Because again, a lot of patients don't want to wait a long time to see the doctor.
Yeah.
They want to just go to the pharmacy and just let them prescribe something.
You see, our work is really cut out for us in the in the Nigerian Center for Disease Control. So I make no assumptions that, you know, this is not like the Niger Bridge, that you bridge it, you build the bridge and you solve the problem. You know, yeah, this really, the work that we have to do as a country on infectious disease is really a long-term challenge. We need to change our mindsets of people, of doctors, of government, of policies. So I think we've started. That's the exciting part of it.
Well, I think, Doc, I think what you need is a TV program of your very own, so you can get this thing journey, because it's repetition after repetition after repetition.
Yeah, we keep doing. I'm grateful to be on your show. That's why I've prioritized coming here today. But we recognize we have a very active social media presence. We push on radio and TV. We have colleagues working with the state health educators. Every local government in Nigeria has a health educator, but they're very often sitting. Yes, they need to be primed and supported. So really, that's a big part of the work that we're doing.
So big kudos to you. Now I know at the first part of the program we talked about moving on to the more complex things. So we know the big four. Well, I'm trying to remember that now: cancer, diabetes, respiratory tract infection, and what's the fourth one? Cardiovascular disorders. Yes. So I know you're thinking about that in the future, and some of the things that you're putting in place, logistics, testing, and all those, and the monitoring and evaluation will help you to move on to that.
Absolutely.
Is there a time in the future when we can begin to start expecting that out of you?
I think the challenge we have in Nigeria is we can't wait for us to finish with one to push on the other. So, like you see recently, government has been, you know, working with the private sector, with NSIA to develop cancer treatment facilities and all of that. But, you know, we will soon get to the point where we realize we can't treat our way out of this. We have to go back to the first principles of prevention, at least for those that are possible. And early detection for the whole list of cancers that are very difficult to detect early, but there are a lot that are very easy to detect early. So we need to, once the next focus should really be on, you know, for the cancers, at least for the screening, for those cancers that can be detected early, the same for cardiac diseases and diabetes. Right. But the whole public health agenda really needs, it's a tough sell in any context, because it's easier to demonstrate success by building big hospitals.
Exactly.
But really, to really affect the health of populations, prevention and public health is really where focus of any government should be.
Absolutely. I want to say a big thank you for what you're doing. I know that Nigerians everywhere would really
Thank you very
benefit
much.
from this. Thank you again for the time. I know it was really tight, but you made it happen. So we really appreciate
No,
you.
I'm very grateful for this. It's a really important part of my job to speak directly to Nigerians. So this gives me a rare opportunity to do just that.
Great. So that means we can ask you come back again.
We'll always try and fit it in.
Appreciate it.
Okay,
Thank you again.
Thanks a lot.
All right, folks. So again, thank you for joining us. We will be back next week. Stay tuned. Get on our platforms. Remember, your health is in your hands. I'm Dr. David Ajibade with the Brain and Body Foundation. See you next week.